How do you feel the space? Dork. Hey guys, welcome back to Dental Dork. My name is Chrissy and I'm a registered dental hygienist. So I just wanted to make a quick video on different treatment options to fill the space that the OsteoRestore or the AGGA appliance has now created. First, I want to emphasize on discussing your options with your provider. So there are two main routes that you can really take. You can take a restorative route or you can take an orthodontic route, or even a combination of both. Depending on what your treatment goals are, whether it be opening up your airway or addressing your TMJ or just for aesthetics, you have a little bit of leeway with some different options. You also want to consider the health of the gum tissue and the bone, in addition to other factors such as age, lifestyle, job. There's a lot of different factors that play into making a decision on how you want to proceed forward to close these spaces. So as far as the restorative choice, the biggest question is, can I get implants to go in that place? And the answer totally depends. Mostly when I see implants used, it's because those premolars, those first premolars were previously extracted from orthodontics priorly done, and they've used the OsteoRestore or the AGGA appliance to regain the space that was eliminated. So placing implants back into those spots to replace the premolars, that might be a good option for you. I have seen implants placed when premolar extractions were not done, so then the patient ends up having 2 molars, 3 premolars, and then all the front teeth. I don't really have an opinion formed on whether this is a good or a bad thing. I think, again, it totally depends on the goals of the treatment and what you and your provider decide to do. Another restorative option I've seen is actually using bridges, restorations that you use a crown on the canine, crown on the premolar, and a pontic or a fake tooth connecting to fill that space in between. Usually they don't like to do bridges or restorative work on teeth that don't have any problem with them. If they already have a crown on them or they've already got an older filling on them that's starting to break down, it's a lot easier to provide that as an option versus a tooth that's perfectly healthy and has never had anything wrong with it. Another thing I've actually seen is the use of a flipper or a denture that has 2 teeth on the sides of it, so it comes in and out and it just fills that space with a fake tooth. Most of the time this is temporary. It's kind of used as a waiting period to determine to A, save the space, but B, make it aesthetically pleasing, just until they can decide what route they're gonna go. So I think that there's a number of options out there. A full restorative case is also an option if you're a candidate for that. That is definitely something that your doctor would have to determine, but it is possible to use crowns or restorations or onlays or whatever the doctor deems possible to kind of create like a fixed splint, so that if you're a patient that is having TMJ issues, you don't have to go through the whole process and you can kind of have an orthotic that's permanent. I kind of feel like I'm rambling now, but either way, there's lots of different options out there. I just wanted to touch on a couple of them, but be sure to talk to your doctor to determine what the best thing for you is. Personally, for me, I've decided to go with the orthodontic route. Contrary to what all my friends and family think I should do, they would love to see me get implants, just screw them in and be done with the deal. However, I really want to use controlled arch to pull my molars forward up and out of my airway. The controlled arch has a couple of different things that goes along with it. It's not just braces, but it also includes occlusal pads, which go on the first and second molars, in addition to 2 FRLAs, which are fixed removable lingual wires. Basically, it's a band with a wire that goes on the inside arch of your maxilla and your mandible, and it doesn't actually touch any of your teeth, but is fastened to the band on your first molar. I'm not completely sure its purpose, but my understanding is that it does 2 main things. The very first is actually creating an anchor or some stabilization for the controlled arch to kind of use. They kind of work together. And then the second thing that it does is it applies a little bit of pressure to move the teeth a little more buccally in the bone. So although it's not bone expansion, it's just moving the teeth to have a broader arch. I hope that makes sense. Alright guys, I hope this was helpful. If you could like this video, comment below with any questions, and click subscribe to see more from your dental dork. Have a wonderful day, guys.